Diuretics relieve pulmonary congestion and peripheral edema. These agents are also useful in reducing the symptoms of volume overload, including orthopnea and paroxysmal nocturnal dyspnea. Diuretics decrease plasma volume and, subsequently, decrease venous return to the heart per load. This decreases cardiac workload and oxygen demand. Diuretics may also decrease afterload by reducing plasma volume, thereby decreasing blood pressure. Loop diuretics are the most used diuretics in HF. These agents are used for patients who require extensive diuresis and those with renal insufficiency. Overdoses of loop diuretics can lead to profound hypovolemia. As diuretics have not been shown to improve survival in HF, they should only be used to treat signs and symptoms of volume excess.